So today, before I do your physical examination, I'd just like to take some quite detailed information just regarding the issues that you're having with your skin. Okay, so if you can be as detailed as possible with your answers, that would be really helpful. So I'm just going to ask you a range of questions just regarding the symptoms and history of the skin problems that you're having, okay? So I'll just be typing that information up as you give it to me. So as much information as possible would be really helpful. Okay, so this will just give me a better understanding of the problems that you're having with your skin and how we can look to help to treat that. Is that okay? And then once we've done that, I'd like to do quite a detailed examination and skin inspection as well. Okay, perfect. So I'm just going to begin just by asking you to confirm your name and date of birth, please. Thank you. 31st, okay. Okay, so what I'd like you to describe to me is just the nature of the problem, where on your body, the duration, and just your general symptoms. Okay. Yep, okay. So quite a lot of itching. Okay. Which then kind of leads to swelling and redness. Okay. Which is then leading to your skin becoming infected. Okay. And where on your body would you say that's worse? Okay. So you'd say it's worse on your back, arms, so including the creases of your skin, so in your elbow, wrists, and between the fingers. Is that right? Okay. And what have you been using on your skin at the moment? Okay, so moisturisers. And what kind of moisturisers have you been using? Okay. And anything else? Okay. And how often would you use those moisturisers? Okay. And previously in the past, when you've had topical steroid creams, has that been prescribed by the GP? Okay. And is there anything that you feel kind of makes your skin better? Anything that seems to make it worse? Yeah? Okay. So it seems to improve during the summer months. Okay. And you've noticed if you feel a bit stressed, it seems to flare up. Okay. And does it affect your sleep at all? Okay. And how do you sleep generally? And any recent illnesses? Okay. And are you on any medication? Okay. Yeah, including kind of any over-the-counter or herbal remedies. Okay. Yep. Okay, that's great. And do you suffer with anything like asthma or hay fever? Okay, so occasional hay fever. And how do you normally treat that? Just antihistamine. Does that help? It does. Okay. And do you have any kind of family history of skin conditions, including eczema? Okay, so siblings with eczema. And any other skin conditions that you're aware of in the family? Yeah, okay. And what do you typically normally use to cleanse your skin? Okay. Okay, so when it comes to things like soaps and detergents and things that you're washing your clothes in, do you tend to stick to the same thing? Have you kind of tried to change that to see if there's any improvement with anything like that? Okay. Yeah. Okay. And what is your occupation, please? Thank you. So I'd imagine with that kind of job you're kind of possibly wearing gloves. Okay. And kind of frequent hand washing, and how about the use of hand gels and things? Okay. So these are all things that can, add to kind of irritate the skin, just with you saying it was kind of worse in between the fingers. Obviously those things, can be contributing. Okay, so do you have any allergies, including any food allergies? Okay. So you're allergic to gluten, okay. And when was that diagnosed? Okay. And what were your symptoms in the lead up to that? Okay. And how are you dealing with that at the moment? Okay, so you're just kind of trying to find the right foods that kind of agree with you. Okay, that's fine. So in the past, when you have used the topical steroids, how long would you say typically that you use those for? And is there anything that you would say has been particularly effective in treating your skin, or anything that you found that kind of seems to irritate it more? Okay, yeah, so Aqueous. Okay. And you've not previously been prescribed any kind of emollient? Okay. Right, okay, that's fine. Okay, so thank you for providing all that information for me, that's really helpful. So before I just go ahead and do the physical examination and just a bit of a skin inspection, so what I would advise as well is just that we prescribe you an emollient, okay? So with conditions like eczema, the skin becomes really dried out, so what you want to do is to avoid that as much as possible. So I know that you said you've been using moisturisers and things. I would say some of those things, maybe the perfume content is quite high, so they may just irritate your skin a little bit. So we want to use things that are kind of, if possible, perfume free. So the emollient that I shall be prescribing today is one that is called Hydromol. So this can be used as a body wash as well, and it can be used really frequently. So I'm going to ask you to use this daily, but you can use it more than once per day if need be. So what we're looking to do is to avoid the use of the topical steroids as much as possible. There may be times when just an emollient isn't effective enough to treat your skin, but if we try to keep the skin as hydrated as possible, then that will just kind of reduce and help to prevent the use of steroids. Yeah. So you've used the hydrocortisone before. Okay. Do you remember which one that was? Yep. Okay. And you've used Benevate before. Okay. And how did you find that? Really effective. Okay. And you found that aqueous tended to irritate your skin. Okay. So I think with the Hydromol, it tends to cause less irritation than some of the emollients, so I think this will be definitely a good one to try. And you can also use it as a body wash as well. So if you're using both the emollient and the CeraVe cream, the best time to apply your emollient is after bathing or cleaning your skin. So you would apply your emollient, and then if you're also applying the CeraVe cream, just if you leave a period of between 15 to 30 minutes, just allow that to kind of soak into the skin before you apply anything else. Okay. But what I'd like to do next is just give you an examination, okay? So I'm going to be examining the areas that we've just talked about as well. So your back, arms, including those areas that you said tend to be causing you the most problems. So hands kind of in between the fingers, the arms, including the creases. So with you also saying, that for your occupation you are wearing gloves a lot, you're frequently washing your hands and using hand gels, which can be quite harsh. So with those, I would just say just to make sure that you are thoroughly drying your hands after washing, just to make sure in between the fingers as well is nice and dry, and you don't want to kind of rub or too harshly kind of dry your skin, but just to make sure that it's dry just in between those periods, because sometimes if you can leave, sometimes it's kind of easy just to leave the hands kind of still a little bit damp, and those areas in between the fingers can be quite irritated. Okay, so let's go ahead and do your examination. Okay, I'm just going to ask a chaperone to come in while I do the examination, and I'm just going to ask you to come over here just onto this side of the room so I can do that. Is that okay? Brilliant. Okay, so today before I examine you, do you have any pain or discomfort other than your skin that we've talked about? No. Okay, so I'm just going to be having a look over your skin, just paying attention to the areas that you're having more problems with. Okay, so would you say that today is a good day or a bad day for your skin? Is this normally how it looks? Okay, so this is a good day. Okay, no problem. So I'm just going to start with your hand and your arms, okay? And is it okay for me just to roll the sleeves up here just so I can have a good look? Okay, so I'll just do that first of all. So I'm just going to take your hand here, if you don't mind. You can just rest it on mine. Just going to have a little look at your nails here. Okay, so no problems with your nails. Okay, just going to have a little look in between your fingers here. If you just spread your fingers out like this for me, thank you. So it's been here, on the inner fingers here where you're having a bit of and itching. Okay. a little feel of your fingers here. Okay. And you don't have any pains in your joints or anything? No? Okay. Just gonna have a little look here. Just gonna shift it down your hand over here. Just gonna have a little look at the palms of your hands. Okay. That's fine. So now I'm just gonna look at your arm here. Okay, so this is where you're having problems here on the inner, but and also on the wrists. Okay, let's just have a look at your skin. See a bit of redness here. So this is where you've been using the steroid creams. Okay, I'm just gonna have a look at your arms here. Okay. And if you wouldn't mind just holding your arm up like this, I'm just gonna have a look here. Okay, that's fine. I'm just going to have a look at the other side as well. I'm just going to start with your hand here, just check it out. Let's see. Okay, I can see you've got just a patch of redness here. That feels quite dry and quite swollen here. Okay. And just a little bit of scarring here as well. So this is where you're having the most itching on this area of your hand. I'm just going to have a look in between your fingers. Okay, I'm just going to have a little feel of your joints here. And just on the thumb as well. Look in between there. Okay, so I'm just going to have a look over your skin here, just where you have some tattoos. I just need to get a little bit closer and just have a little. Okay, so just here, just in the inner elbow, just a little bit here on your wrist. Okay, just turn your arm over for me, thank you. Your skin's a little bit dry here as well. Okay, and how long have you had your tattoos? Okay, so around 2 years. And you had some issues with your skin before the tattoos? Okay. Okay. Just gonna have a little feel here. Okay. That's fine. Okay, so your skin just feels a little bit dry. Also has some patches which are definitely a little bit raised and a little bit of redness and scarring here. Okay, so that is quite okay. And you said this is where it's causing a lot of itching. Okay, that's fine. So I'm just going to have a little look at your neck here, okay? Just have a little feel here. Okay. It's fine. I'm just going to just have a little look at the back of your ears if you don't mind as well. Okay, that's fine. It's fine, thank you. Just put your head right back. Have a little feel here. Any discomfort in your neck? No? Okay. And your neck seems fine. You don't seem to have any kind of dry or sore patches on your neck. Okay, what I'd like to do next, if you don't mind, is just have a little look at your back, okay? So I'm just going to ask you just to turn around and I'll have a quick look at your back. Okay? So do you mind if I just move your clothes over just so I can have a closer look? Is that okay? I'm just going to move this here. Don't mind. And again here. So I'm just going to be having a little feel over your back, okay? And then I'm just going to be having a look over your skin. So I'm just going to have a little feel around first of all. You don't have any moles or anything on your back or any. Okay. Okay, that's fine. I'm just going to have a little feel of your skin here. Okay, so your skin on your back is just a little bit dry more than anything. There's no kind of areas of redness or any swelling on your back. So this just gets quite itchy. Okay, I'm just going to have a little look at the back of your neck as well, if you don't mind. Okay, just. Okay, so again, just some areas where you have some redness and just a little bit of drying of the skin, but nothing too. Okay. Okay, the upper back was fine. I'm just going to have just a little look here at the top of your arms. Okay. Okay, that's fine. Okay, thank you. I'm just going to pop that down here. Okay, so today I'm going to be prescribing you an emollient. That's just going to help with the stopping your skin from drying out. Okay, so I'm just going to ask you just to. Okay, and you can just turn back around now. We'll just I will give you your prescription for some creams, and we'll just have a little chat. Okay.